Assalamu alaikum wa rahmatullahi wa barakatuh. Today, inshallah, I'm gonna to talk about the feature of lymph node that can be evaluated by ultrasound scan. So, this is me. I am Al-Hassan from Jazan University. Our objectives today, the first one, lymph node. The second one, feature of normal lymph node in size and shape. The third one, etiology lymph node, enlargement, and the common cause of enlargement lymph node. The fourth one, feature of abnormal lymph node by ultrasound scan. The fifth one, feature of lymph node that can be evaluated by ultrasound scan. And last one, uses and aims of ultrasound scan. So now let's begin with the first one, lymph node, and what is mean by this one, lymph node. The lymph node are for the proper functioning of the immune system. In the lymphatic system, lymph node is considered as a secondary lymphoid organ. So there are primary lymphoid organ and secondary lymphoid organ. The primary lymphoid organ has thymus and bone marrow. The secondary lymphoid organ like lymph node and spleen. Lymph node usually occur in group and are strategically arranged at various sites in the body. And I think there are over 800 lymph nodes in the body, and there are, I think, around 300 are located in head and neck. The feature of normal lymph node. So see with me in this beautiful picture. The lymph nodes are so small, oval or bean shaped. Each lymph node is surrounded by a capsule. This capsule extends inside to form trabeculae. The substance of lymph node is divided into the outer one and the inner. The outer one is called cortex and the inner is called medulla. And as we know, the lymph node is very important in our immune system because have two components, lymphoid follicles that contain B cell and the paracortex that contain T cell. Etiology, lymph node enlargement. There are many causes of lymph node enlargement which include infection. Wide variety infection are the most common cause of swelling of the lymph node. Also, bacteria or parasitic infection response to injury caused to the area and neoplastic, and there are some drugs that can cause enlargement of a lymph node. Swelling of a lymph node symptoms. Patient may experience swelling lymph node symptoms, upper respiratory infection as a coughing, metastasized cancer, fatigue with fever, and runny nose. The feature of abnormal lymph node by ultrasound. Sonographic feature that help to identify abnormal lymph node. See here with me. As we know, the normal lymph node is a shape is oval or bean in shape, but here the shape is converted to round. So this is abnormal lymph node. Also, the abnormal lymph node by ultrasound absence helium, intraneedle calcification, also peripheral vascularity, and short axis diameter 8 millimeter or more, and heterogeneous echo texture. So the feature of lymph node that can be evaluated by ultrasound scan. So here are some example of normal lymph node. See here the first picture, the ultrasound showing cervical lymph node oval in shape, normal echogenicity, and maintain their normal echogenistic helios. But these two pictures are abnormal because see here the patient with the metastatic lymph node show over cervical node, over cervical node in hypoechoic, and the shape is around, the normal is oval, this not oval, and without echogenic helios. Here the last one, the ultrasound showing lymph node, note the presence of peripheral vascularity, which is the common in malignant node. So the uses and aims of ultrasound scan. The ultrasound scan is useful imaging tool in the assessment of cervical lymph node. This one is very important to know. The major role of ultrasound is to differentiate pathological node like metastasis, lymphoma, tuberculosis for normal node. Also, the ultrasound is widely used in evaluation of the shape and number and size and vascularity and the other. Also, to provide the radiologist with a key practice-based approach to aid the clinician. So here I think I have done. If you have any question, please don't hesitate to contact me at my email for any question. Very thank you.